So the CDC expects that wide transmission of the coronavirus will happen over the next few weeks. They expect that 50 through 70% of the US population will be affected. In this video today, we're going to talk about the coronavirus. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those that are new to the channel, welcome. My name is Dr. Antonio Webb, an orthopedic spine surgery fellow. So, a couple of things to start off this video. Number one, I am not an expert in this. I am solely a physician who has a following on social media, so I felt it was my responsibility to speak on this issue. Normally, I don't get involved in things outside of my expertise. My channel is mostly for pre-meds to inspire people to go into the field of medicine. Rarely do I speak on issues like this, but given everything that's going on, I wanted to at least give my opinion as a physician. And number two, the information that I'm going to present all is factual evidence. It's supplied directly from the CDC. For people who don't know what the CDC is, it's the Centers for Disease Control. And number three, I think that people should not panic over this. It's very serious, as we will talk about, but you shouldn't panic. So first, to start off, what is a virus? You're hearing all these words, coronavirus, COVID-19. What does that mean? Well, viruses are microscopic pieces of genetic information that is surrounded by a coat of protein. And viruses are invisible. We can't see them, but they can be very deadly and they can spread really fast. By themselves, viruses cannot do anything. They need a host to be able to survive, to be able to replicate. And that's why when a virus gets inside of a body, it can be pretty dangerous. There are many types of viruses. There are ones that affect plants, there are viruses that affect animals, and there are viruses that affect different organisms. So the COVID-19 or COVID-19 or coronavirus is a respiratory illness that spreads from one person to another. The coronavirus first originated in Wuhan, China, and they said the source of this virus was actually from a bat. The coronavirus gets its name from the protrusions or the spikes around the center of the virus that protrude from its surface. And people refer to it as a novel virus just because it's a virus that we haven't seen before. It's a new virus. The current scientific consensus is that the virus can be spread from one person to another within about 6 feet or about 2 meters. The virus enters the body through the nose, through the mouth, through the eyes, and attaches to cells within the airway. In a person with a normal immune system, someone who doesn't have a lot of comorbidities, as we call it, or medical conditions, normally your body is able to mount an immune response to this foreign invader, to this virus. And once this virus enters your body, a lot of people have a fever from this because of the response, because of all the cytokines, all the different mediators, molecules that are released as this virus, as the body tries to attack this virus. And normally in a person who has an immune system that is able to mount a response, your body will make antibodies to this virus. So the next time that you get sick from this virus, it will be a quicker recovery, or you may not get sick at all. The problem is that the coronavirus is a novel virus. No one has had it before. So no one has antibodies to it, which makes it a pretty dangerous virus. There's a lot of myths going on out there, a lot of different talks about, oh, the coronavirus is just like the common cold, or it's another version of the flu. Well, partially true. There are symptoms that are very similar to people who may have the flu or who may just have allergies. The most common symptoms are a fever, shortness of breath, as well as cough. But you can have some other symptoms, muscle aches, runny nose, diarrhea, decreased appetite. So the symptoms are very similar to other conditions and other viruses that are out there. And once someone is exposed to the coronavirus, the symptoms can manifest themselves anywhere between 2 days to 2 weeks from that exposure to the virus, and that's called the incubation period. From the CDC's website, the majority of symptoms that patients have are generally mild. There are few patients who have medical conditions like heart disease, lung disease, kidney disease that don't have that robust immune response or are not able to generate that immune response that have more serious symptoms. The most critically ill patients, or the patients that have the most severe symptoms, these patients end up having respiratory failure. This is a respiratory illness, a respiratory virus that attacks the normal cells within the lungs that cause them to be non-functional. A lot of these patients require mechanical ventilation, which means we put them on a ventilator or a breathing machine in the hospital, or the more serious cases undergo what's called a ECMO, ECMO, and this is a heart-lung bypass machine. This is usually reserved for the patients who have very serious illnesses, which their lungs and the heart also starts to fail. Well, the problem is that there is no current vaccine for the coronavirus, which makes it pretty deadly. Coronaviruses usually spread, just like other viruses, from person to person. So if a person is out and they sneeze or they cough, or they sneeze into their hand or cough into their hand and they touch different objects, well, that virus can actually stay on certain objects, certain desks or computers or door handles for up to 72 hours. So the spread of the virus is actually from person to person. That's why that there are guidelines out that say that you should distance yourself from others within 6 feet. So if someone is coughing or sneezing, or someone is, touching things that have the virus, well, that is a potential exposure source to that virus. So through these respiratory droplets, when someone coughs or someone sneezes, well, these droplets can get transmitted from one person to another, get into that person's body, and start replicating. And that's what viruses do. Once they get into the body, get into the cells, they start to self-mutilate, and then they can change their identity and then replicate. And you have millions of copies of this virus, and this virus is transmitted to another person and to another person. They say that the virus actually doubles within 6 days. So if 50,000 people have the virus now, 100,000 people will have it in 12 days, and then double that. So it's an exponential kind of growth, and that's why I think it's really important that we try to contain this virus as much as we can. So the best way to prevent this virus is to avoid being exposed to it at all. And that's why a lot of cities, a lot of states, a lot of countries are starting to mandate restrictions on travel, on sporting events, on large gatherings, on going to public spaces where there are a lot of people. The problem is that coronavirus, even though some patients have symptoms, there are some reports out there that lots of patients may have coronavirus and not even know it. And that's the dangerous part, because you have people that are going into these public places, that are traveling, that are going to sporting events, and they have coronavirus, but they don't have any symptoms. So they don't know that they're exposing thousands of other people to the virus because they're asymptomatic. I think the most important thing to do is to wash your hands. And you need to be able to wash your hands for about 20 to 30 seconds with water as well as soap. There are some studies out there that look at the temperature of the water and whether very hot water is actually detrimental to you and can actually increase the chance that you may get an infection or transmit the virus. Most people would recommend that you use lukewarm water and that you use soap. If you don't have water or soap, others suggest that you use hand sanitizer, but it's really important that you make sure that the hand sanitizer has about 60 to 70% alcohol in it. As we talked about before, this virus can be transmitted, or it can stay alive on certain surfaces for up to 72 hours. So if you are at home or if you're at work, just make sure that you're disinfecting the surfaces, the door handles, the refrigerator door, everything in your house. Make sure you're wiping things down. If you are having symptoms such as a fever, shortness of breath, or a cough, most people would say to don't go out into public. don't expose yourself or don't put others at risk because of the symptoms that you're having. You should stay at home, you should quarantine yourself, you should disinfect your house, everything around you, as well as wash your hands. So I think it's very important that if you have these symptoms, that you should just call your doctor and check with your doctor and ask that person, what should I do? What the hospitals don't need and what the ERs don't need is for hundreds of thousands of people to show up at the ER if they have mild symptoms. As we discussed before, most of these symptoms are pretty mild and it's a virus. It's going to take some time for your body to get rid of this virus. Next, I think it's important to avoid touching your face, touching your eyes, touching your nose. And there are some studies out there that show that most people touch their face up to 15 times per hour. And I know this is hard to do because I even do this myself, but I think it's important to avoid touching your face. I've come across some tips that may help people out there that just constantly touch their face. One thing is to wear a scarf around your neck because you feel like something is there and you're less likely to touch your face. There's some other tips out there in terms of people saying, hey, just put something in your hand so you don't have that tendency to touch your face, but try to avoid touching your face and constantly wash your hands. The next thing is to avoid close contact with people that are sick. So if you're having any symptoms whatsoever, as we talked about fever, cough, shortness of breath, you should quarantine yourself and get yourself away from people that may be at risk for contracting this virus. So the people with heart disease, kidney disease, problems with their lungs, those people are at very high risk and you shouldn't expose or go around these people if you're having any symptoms. I think it's important to distance yourself. You may hear the word social distancing. This is really important with the virus because we talked about that the virus can spread from one person to another within about 6 feet. I would suggest that you avoid handshaking, that you avoid touching different doorknobs or different objects when you're out in public spaces. And even at the hospital, it's a little humorous to see the other doctors, and we usually walk around and we shake each other's hands or we're touching various things in the hospital. Well, a lot of doctors nowadays and at the hospital are actually just giving elbow bumps or they're giving air kind of pounds. Or from across the hall, they're just going like this. I think it's really humorous, but at the same time, it's one of those things that we're doing to prevent the spread of this virus. There are a lot of people out there that I see that are traveling, that are at the grocery stores, that are out in public and they're wearing masks. Well, the CDC really doesn't recommend that people wear a mask except the patients who have symptoms or if you've been in close contact with someone with symptoms. The next group of people that the CDC recommends that they wear a mask are the healthcare professionals like me. When I go see a patient in the ER or when I see a patient on the floor or in the hospital who may have some symptoms of this coronavirus, well, I need to wear a specialized mask called a N95 mask. The mask that you get over the counter buy at the grocery store or just pick up from the hospital, well, these masks are not really protective against this virus. But if you're having symptoms or if you've been in close contact with someone who has symptoms, you should wear a mask. There are some reports out there and some talks that there will not be enough masks for everyone that may have symptoms or if this virus spreads to a point where we just can't contain it and there won't be enough masks. So I think it's really important to don't really stress over the mask kind of portion. Make sure you wash your hands, make sure you distance yourself from people that may be sick, as well as make sure you take all the necessary precautions to protect you and your family. So my thoughts on this and a little summary, a little recap is that this is a very serious condition, very serious problem. It's a pandemic, which is a global outbreak of a certain disease. When I first heard about it, and I was like, oh, it'll be fine, we'll get through it. It's what we always do, but this is actually a very serious problem. And the concern is that people who have no symptoms whatsoever and just walking around fine and not showing no fever, no shortness of breath, no cough can have coronavirus and can spread this from one person to another. So that's the kind of scary part of coronavirus. But I think that people should not panic. I think you should wash your hands. I think you should listen to your healthcare officials at your state level, at the government level, and do what they're saying. They're trying to take all the necessary precautions to prevent this virus from spreading. You know, in other countries like Italy or Spain, no one is able to, over in Spain, able to leave their house, or all the gyms are closed, or the sporting events, all the large gatherings are outlawed. You basically can't go outside of your house. And in places in here in the US, like Washington State, where they say Washington State is like the Wuhan of the US, where the mortality rate is around 35 to 40%, nothing's open, no one's working, because this is a very serious problem. But I wanted to reiterate that you shouldn't panic. Wash your hands with soap and water for about 20 to 30 seconds, and frequently throughout the day. Use sanitizer. Wipe the surfaces at your house, your home. Don't touch public spaces like the doorknobs or the elevator buttons at certain places, because the virus can live on these surfaces for up to 72 hours. I think you should distance yourself, the social distancing that we talked about, from other people who may be sick. Avoid going to open places, large gatherings, you know, churches or sporting events where there's a lot of people. You know, people are talking about traveling, and the CDC actually talks about that airplanes aren't really, you know, that big of a deal because of the circulation and the fans and their filters on the planes. It's the other surfaces. So if you're traveling, when you get on the airplane, make sure you have some disinfectant wipes to wipe down all these surfaces, and then wash your hands or use sanitizer. Make sure the sanitizer has at least 60 to 70% of alcohol, and don't freak out. Check on one another. This is a time where everyone needs to come together and help other people out. I see people online that are buying up all this tissue paper and hogging up all the water, and going to the grocery store and just buying, you know, all these things that they think the apocalypse is, you know, about to happen. Well, just check on people that are around you, especially the elderly people, the people who have medical conditions. They're, you know, diabetes, kidney disease, people that need dialysis. These are the people that are most at risk, and just make sure you're taking the necessary precautions so that those people don't get infected. That would be, you know, really devastating to our country. Keep us in your prayers, the healthcare workers. You know, we're on the front lines. I still have to go to work, even though there are some reports of a lot of our elective surgeries being canceled. But we still put ourselves on the front lines, the nurses, the doctors, the techs, the healthcare, the housekeepers, the people that do the janitorial services. You know, all of these people are putting themselves at risk. So, you know, just do what you can. Don't panic, and we'll get through this. It's going to take a little bit of time. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.